In this video, I want to go over a fairly simple way that you can check to see if the cancer treatment that's being recommended to you is a reasonable course of action. So I think it's very important when you make any medical decision to get a second opinion if possible. But cancer is one of these things that um, you don't want to wait too long and wait for second and third opinions and delay care. So if you want to expedite your care and you can't seem to get a second opinion in a timely fashion, a good way of checking to see if the care that you're being recommended is a reasonable course of action is to go to the NCCN website. So NCCN.org stands for the National Comprehensive Cancer Network. And if you go here, you see cancer treatment guidelines by site. Click that, and then you can see that it lists basically every kind of cancer by site. And so I'm going to pick head and neck cancer because that's what I do. And if you click on that, there's this PDF of NCCN guidelines. You hit that, and it gives you this document right here. It's a pretty large document. It's 239 pages. Click continue. These are the people that worked on this document. Click continue. Okay, and let's just pretend that we have a cancer of the lip. And so you'll want to ask your doctor which of these sites it is. If you're not sure, you're going here and you're not sure what oral cavity versus oral pharynx versus hypopharynx versus nasopharynx versus glottic larynx versus supraglottic larynx is. So ask your doctor what exact site you have your cancer, what type of cancer you have. So let's just pretend that it's cancer of the lip. So basically, the workup is, you should have an exam, a biopsy, and if necessary, you can get these chest CT, PET CT, Panorax, CT of the neck, dental evaluation, nutrition eval. These you may or may not get these. It just depends on how advanced your cancer is. So the more advanced your cancer is, the more of these studies you'll get. And then you need to find out what stage you are. And how do you know what stage you are? If you go back to the beginning of this document, there's a thing for staging here. You click that, and it says staging of the oral cavity, including the lips. So, and then there's staging for nasopharynx, staging for oral pharynx. So there's all different stagings. And so staging is done by primary tumor, lymphatics, and metastasis. So, if T1 means your tumor is less than 2 centimeters in size with a depth of invasion, that means it doesn't penetrate your tissues more than 5 millimeters. If it's more than 5 millimeters and less than 2, then it's T2. Or if it's between 2 and 4 centimeters, it's T2. Or if it's bigger than 4 centimeters, T3. Anyways, you can go through this, ask your doctor what your staging is, and then once you know your stage, let's go back to the lip part of it. You can follow this little diagram. Let's say, for example, you have a very like a T1 N2. All right, here we are. So we have a T1 N2. So right here. So let's say T1 N2. So T1 N2 right here. You're a surgical candidate, so you're healthy enough to get surgery. Then you see treatment here. So surgery is the preferred mode of treatment. So if your doctor's recommending radiation therapy or chemotherapy for this cancer, you'll have to ask them, why are you doing that instead of surgery? Because surgery is the preferred treatment. If you're T1N2, this is it. So resection of the lip plus a neck dissection, which is removal of the lymph nodes on the same side, plus or minus doing the other side. So doing the other side kind of depends on how much the cancer is going across to the other side and what your risk of having nodal metastasis on the other side is. So let's say that you do this, and then you have one positive node without adverse features. But if you had two, you probably have adverse features because you have more than one lymph node. And then let's say that there was external extension and or positive margin. So this is bad if this is what you get on your pathology. But let's say there were no other, then you would get radiation therapy afterward. So if you're not getting recommended radiation therapy, you should ask your doctor how come we're not getting recommended radiation therapy, and then it talks about follow-up. So anyways, there is this document. It's accessible to anyone. When you click on this initially, they'll ask you to sign up, and you should sign up as a doctor, even if you're not, and you don't have to prove that you're a doctor to get access to this document. You just have to register like any other website, and it's free. And you can get any of these guidelines and kind of go through it. There's a wealth of information in this document. It's they talk about everything in here, different chemotherapies, different radiation regimens, and then the people that put together this document went over, looked at over 600 papers to put this document together. It summarizes treatment recommendations from review of over 600 papers in the literature about this type of cancer. So I hope this was useful to you. If you have any questions, please comment below. And thanks for watching.